Hello, my name is Georgia Delgado. I am from Catholic University of Santiago de Guayaquil, and today I'm gonna talk about Emicizumab prophylaxis in patients who have Hemophilia A without inhibitors. Let's start with definition. Hemophilia A. Hemophilia A, also called factor A deficiency or classic hemophilia, is a genetic disorder caused by a missing or defective factor A, a chlorine protein. Although it is passed down from parents to children, about 1 to 3 of cases are caused by a spontaneous mutation, a change in a gene. Symptoms. Symptoms of Hemophilia A. People with Hemophilia A often bleed longer than other people. Bleeds can occur internally into joints and muscles, or externally, from minor cuts, dental procedures, or trauma. How frequently a person bleeds and the severity of those bleeds depends on how much factor A is in the plasma, the extracolored fluid portion of the blood. What is hemophilia?
So, what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth, for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of 2 kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut. But you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life and follow your dreams without hemophilia ever holding you back. To learn more about hemophilia, visit worldhemophiliaday.org.
Applications in medicine. Emicizumab for hemophilia. Emicizumab is a B-specific monoclonal antibody that bridges activated factor 9 and factor 10 to replace the function of the missing activated factor A, thereby restoring hemostasis. In phase 3 multi-center trial, we investigated its use as prophylaxis in persons who have Hemophilia A without factor A inhibitors. Treating hemophilia. Treatment for Hemophilia A.
Hemophilia A is an inherited bleeding disorder caused by a deficiency in factor VIII activity. The current standard of care includes prophylactic intravenous factor VIII infusions. However, these infusions may result in the development of anti-factor VIII antibodies that can inhibit efficacy and increase morbidity. Intravenous bypassing agents such as activated factor VII and activated prothrombin complex may be required to counteract these effects. Emicizumab is a recombinant humanized bispecific monoclonal antibody that binds to activated factor 9 and factor 10, brings them into proximity, and restores the scaffolding function of the missing activated factor VIII. In the Phase 3 international open-label HAVEN study, investigators randomized in a 2-to-1 ratio 53 participants with hemophilia A of any severity who had documented high factor VIII inhibitor levels and episodic treatment with bypassing agents to receive weekly subcutaneous emicizumab prophylaxis or no prophylaxis. An additional 56 participants who had a history of prophylactic use of bypassing agents or who were not able to enroll in other study groups were assigned to treatment with emicizumab. The primary endpoint was the reduction in annualized bleeding rates after 24 weeks of treatment. Emicizumab prophylaxis resulted in a statistically significant decrease in the annualized bleeding rate to 2.9 as compared with 23.3 in the no prophylaxis group, which represented a decrease of 87%. In addition, 63% of the participants randomized to emicizumab prophylaxis had no bleeding. Thrombotic microangiopathy and thrombosis were serious adverse events reported in 4 participants receiving both emicizumab and activated prothrombin complex concentrate, but these effects resolved after cessation of the bypassing agent. The authors conclude that emicizumab prophylaxis prevented or substantially reduced episodes of bleeding in patients with hemophilia A with inhibitors. Full trial results are available at nejm.org.
Pros and cons. Experiment and results. Subcutaneous emicizumab prophylaxis administered once weekly or every 2 weeks resulted in bleeding rates that were significantly lower by more than 95% than the rate with no prophylaxis. With each randomized emicizumab regimen, more than 55% of the participants had not treated bleeding events, and more than 90% of the participants had 3 or fewer events. Experiment. Hemophilia, clinical and patient perspectives on emicizumab.
So let's segue into your past treatment was using factor as you needed it, or what we call on demand or episodically.
Right.
And we discussed doing prophylaxis, but then this opportunity to participate in a clinical trial with this drug called emicizumab. And I'll just give you a little bit of background on what emicizumab is. It's not factor, it's what we call a non-factor therapy, and it was developed, it's a therapeutic monoclonal antibody, and it's called a bispecific monoclonal antibody. That means it binds to activated factor IX and factor X, and it mediates the activation of factor X. And so the role of factor VIII is to bind activated factor IX and 10, bring them together, which activates factor 10, and that goes on to activate the rest of the clotting cascade. And in hemophilia patients, you're missing factor VIII. So this bispecific antibody takes on this role and will bridge the binding of 9 and 10 together, and thus it activates 10, and then it restores hemostasis.
Right. So it's like a bunch of dominoes.
Exactly.
And factor VIII is one of the dominoes that's missing.
Right, and it's a very
and the
important
new drug
domino.
tricks the next 2 dominoes saying, hey, factor VIII already happened. Go, keep doing your job.
Right, and so that's kind of the mechanism of action, and we asked you to participate in using this, and so it was this drug was used for both patients with inhibitors and without inhibitors in hemophilia A. So what was your experience with emicizumab when I asked you to do it?
Oh, I thought the potential was amazing, and I mean, the only thing I can really say about it is it's life-changing. It has been life-changing, so I've been on it for a year and a half or something like that now, right? I have not done a single factor VIII infusion in that time. And you know, this infusion is so super convenient also. Like I do, my protocol is like 1 shot every 2 weeks, and it's like a diabetic shot. It goes right in the fat, not in the vein, so it's really easy to do. I don't have to worry about missing veins. And it's like, it's like 2 cc's, it's very, very little. And then all of a sudden I'm good for the next few weeks, right? So that's been just a huge, huge life changer. So now, like when I feel a little bit of pain, You know, when I was a kid and I would procrastinate and say, oh, it'll go away, and never did. Now I'm like, okay, I have a little pain, it'll go away, and wait, it does go away. So I'm like, oh, this is new. Don't know how this is. So it's been a complete life changer and game changer, I think.
Issue applied in Ecuador. Fun fact. In the Ecuadorian Foundation for Hemophilia, there are 790 registered patients who suffer from this disease in this country. The main medication to treat Hemophilia A is a concentrated factor A product called clotting factor or simple factor. Discussion.
Treatment for bleeds in hemophilia has been around now for about 30 to 40 years. Before that, there really was no therapy that existed, and patients who would get bleeds, their joints would usually swell up and it would be very, very painful. The consequences of that would be that they would destroy their joints at young ages, and by the time that these children would be adolescents or adults, they were often quite crippled.
Once I've determined that I do have a bleed, then go about getting the factor. Once you get it, then you mix it, and then you do an infusion.
Patients with hemophilia are missing factor, so we can simply give them factor. At least for a period of time, they have quite enough factor to stop any bleeding and also to prevent bleeding.
In the blood, there are a bunch of different factors, and they basically help out the platelets that clot the blood. So they basically form like a spider web type thing, and it enables the clot to form properly.
So it has to be given through an intravenous, put into a vein, and then it lasts for a few days, but it will disappear.
Most people do home infusions now, like you can do it yourself or have a parent do it. Sometimes you might come to the hospital to have it done. Camp, that was the main part when I started learning. Every day I'd do an infusion myself. The nurses were like extremely helpful. That was basically what got me started in infusing myself.
Those with less than 1% factor 8 or 9 into moderate hemophilia where they bleed infrequently.
Patients with hemophilia, unfortunately, particularly in the 1980s, were exposed to a number of viruses such as HIV and hepatitis, and back then that was the most feared complication of having hemophilia, but that really is a thing of the past, and it's no longer something that is seen at all.
So if I could do one thing across the globe, I would ask that all persons with hemophilia had full and equal access to safe factor concentrates, because I think that's the most crucial thing right now. Because if you have that, you can treat, you can take away pain, you can do surgery, you can prolong life, you can do all of the things that we've come to take for granted.
Conclusion. Emicizumab prophylaxis administered subcutaneously once weekly or every 2 weeks led to a significantly lower bleeding rate than no prophylaxis among persons with hemophilia A without inhibitors. More than half the participants who received prophylaxis had no treated bleeding events. Thank you.